The growing concerns in China as the country deals with a rise in respiratory illnesses. The World Health Organization formally asking Beijing for more details on the spike in cases.
Take a look. This is what the Chinese hospitals look like right now, and you'll notice in these pictures that this is targeting the young and the elderly. Take a look at this article, came out 3 days ago. Undiagnosed pneumonia outbreak in China puts pressure on pediatric hospitals, prompting questions. This came out on the 22nd. Look at the 23rd. What is the mysterious pneumonia outbreak in China? The WHO has asked China for more information about the undiagnosed respiratory illness that has spiked since October of 2023. So in the past month, we're seeing this beginning to spread. This is an epidemic in China, and people are beginning to wonder, could China's child pneumonia outbreak spread? Here is everything that you need to know. And here's an article that has come out in the past 48 hours. Chinese hospitals overwhelmed with sick children after the surge in respiratory illness. Now, China has reported an increase in respiratory illness as it enters into its first flu season since lifting COVID restrictions. The WHO says the spike is being caused by known pathogens and does not pose a global threat. But a lot of people are skeptical. Let me know your thoughts in the comments down below. Can we trust what is being reported by China? Do they have this under control? Is this simply a Chinese epidemic as a result of the lifting of their COVID restrictions and exposure of weak immune systems after being in lockdown for so long? Let me know your thoughts in the comments down below. But I'm going to share with you the latest video footage and the articles coming out in the past 72 hours so you know exactly what's taking place. But before we dive in, do me a quick favor. If you appreciate the updates, don't forget, smash the like button. Just takes a second. Helps out the channel a ton. Thank you so much. And if you want to stay up to date, it's totally free. Why not? Just hit the subscribe button, turn on that notification bell. And if you want to become a member and support the channel, I've added a join button. Just click it. And as a result, all of these articles will pop up in your YouTube feed. I cite all my sources, and even if you don't become a member, I still cite them anyways. They are all linked in the description below. But with that being said, let's go ahead and take a look at this and get you caught up on the latest with this mysterious Chinese pneumonia that is spreading, and many people are wondering, will this become global? Let's go ahead and take a look. All right, so as always, link in the description below to this article. This is from the University of Minnesota, came out on the 22nd, so 3 days ago. I'm going to scroll right down and get to the main point. 3 days ago, they said more information is needed. Now, the U.S. Center for Disease and Control Prevention, or the CDC, background information on Mycoplasma pneumonia infection notes that the bacterium typically causes mild respiratory infections that can sometimes lead to serious illness that can require hospitalization. Now, in children, the infection resembles a chest cold. The illness can spread in crowded settings, including schools and college residence halls, and we've heard that schools in China, there have been many children missing as a result of what's taking place. Now, on Twitter or X today, it says, an infectious disease physician who is with the WHO Health Emergency Program said it's possible that China could be seeing a surge in respiratory infections as other countries did their first winter after lockdowns were lifted. She added that China has already reported a mycoplasma pneumonia surge, but the current outbreaks could be anything. She also said respiratory viruses, COVID-19, and flu could be contributing factors. The point is, we need more information. Now, as we mentioned, they said they believe they have this under control, and they believe they know the causes, that these are typical pneumonia spreads. But this is an article coming out on this 2 days ago. Link in the description below, and it says, what is the mysterious pneumonia outbreak in China? It says, as China experiences its first winter without the strict COVID-19 restrictions since the outbreak of the pandemic 3 years ago, a wave of respiratory illnesses is sweeping across the country. The unusual rise in cases has prompted the World Health Organization, or WHO, to prod China for additional information on the outbreak and seek enhanced response measures. Although the cause of this trend is unclear, some health experts are attributing it to a common and temporary after effect of the lifting of lockdown restrictions, even as unanswered questions around the infections and the country of their spread have led others to draw parallels with the early days of the pandemic, and that is without a doubt one of the biggest concerns here. Are we experiencing a repeat of what took place 3 years ago? So what do we know about China's pneumonia outbreak so far? Well, on November 13th, China's National Health Commission reported an increase in respiratory diseases at a press conference. On Sunday, clusters of undiagnosed pneumonia in children in northern China were reported by the Program of Monitoring Emerging Diseases, or PROMED, a surveillance system that conducts global reporting of infectious disease outbreaks. It is unclear if this report overlapped with the press conference information. According to the PROMED report, infections have proliferated in Beijing and the city of Liaoning in the country's northeast, which are 800 kilometers or 500 miles apart. On Wednesday, the WHO asked China to release information on the recent outbreak, including additional epidemiological and clinical information, as well as laboratory results from these reported clusters among children. Although official figures on the numbers of cases are not available yet, hospitals in Beijing have witnessed a surge in patients, especially in those in children's wards. One of the major hospitals in the city has reported that on average, every day, they are seeing about 1,200 patients entering the emergency room. Schools in Beijing are reporting high levels of absenteeing, even dismissing entire classes for at least a week if some students are ill, and warning parents to be extra cautious. Health officials are also worried that winter will exacerbate the spread of the infections after a warning from China's National Weather Authority that starting on Thursday, the country's cold temperatures will plunge even further. Now, why is pneumonia spreading in China? Authorities from China's National Health Commission attribute the rise in cases to the lifting of the COVID-19 restrictions. Health experts have also agreed that this could be the reason, similar to the lockdown exit wave that was witnessed in countries like that of the UK. China may be repaying an immunity debt after their lengthy lockdown, which must have drastically reduced the circulation of respiratory bugs and hence decreased immunity to the epidemic bugs. They added that based on the current information, there is no reason to suspect that the emergence of a novel pathogen and that Mycoplasma pneumonia, the probable source of most cases, and a bacteria that typically affects young children, is generally fairly harmless. Chinese authorities listed mycoplasma as one of the circulating pathogens along with respiratory syncytial virus or RSV and SARS-CoV-2, the virus that causes COVID-19. The WHO has asked China for more information on the recent patterns of these microorganisms. Now, while the presence of the novel pathogen is a possibility until more information is made available, the outbreak could also be due to an existing but newly mutated pathogen with modified characteristics and severity. Both scenarios would be a global concern as pathogens will cross national borders sooner or later regardless of preventative measures. So in other words, they're saying that yes, this could be a concern if it spreads further. What else can be expected from the outbreak in China? At their press conference, China authorities said that there is a need to step up disease surveillance and strengthen the capacity of health systems. The WHO and the medical staff in China have also advised people in the country to reinforce practices from the COVID-19 pandemic era, such as rigorous hand washing, wearing masks, and social distancing. In the Liaoning province, people have been queuing up the traditional Chinese medicine hospitals while patients at Dalian Children's Hospital have had to wait in line 2 hours, according to the ProMed report. Although the medical staff are concerned about the spike in the infections in people under the age of 18, they're also worried about the vulnerable populations such as the elderly or pregnant women. You reported outside of Beijing's Children's Hospital as a steady stream of parents walked hand in hand with their children behind her. Experts have agreed that more definitive information is needed on this illness. So essentially they're saying this could be a very contagious pneumonia that is spreading around and particularly hitting children, and there's also concerns for the elderly, but they're seeing it primarily in young people. Now, what is pneumonia? Pneumonia is the inflammation of the air sacs in the lungs due to bacteria, viral or fungal infection, commonly affecting younger children and older adults. The infection can be due to the illness are highest in Asia and sub-Saharan Africa, according to the WHO report. Symptoms tend to include chest pain, coughing, fever, and fatigue. Although the illness takes a toll on one's lungs and body, it can be treated with antibodies when caused by bacteria. Recovery timelines typically last from a week to a month or more. Now, they are referring to this as walking pneumonia, which means that it's not as serious as the common pneumonia that a lot of people get, but they're saying that this is extremely contagious, and we will see as more information comes out. I'll be sure to keep you up to date here on the channel. Now, this comes as, in addition to that, we've also received warnings from WHO and from experts around the world about Disease X and also about other viruses that could be spreading, and they're concerned that this is going to be coming sooner rather than later. A lot of people say that global pandemics hit once every generation. However, they're warning that we could be seeing something here very soon in the next couple of years. Let me know your thoughts in the comments down below, but I'll be sure to keep you up to date every step of the way. And to get more information on Disease X and what they're saying, be sure to check out this video right here next, and I'll keep you up to speed on everything. But with that being said, you guys, thank you so much for joining me, and I'll catch you in the next video. Take care. God bless. This is Steve.